All right, so while they're putting on their mics that are in the chair, we're now going to have the panel discussion where we'll reflect on the day's discussions. And we've asked that each of the panel members provide a 5-minute reflection on their own thinkings and learnings and future directions for the day. Returning is Dr. Viswanath from Harvard T.H. Chang School of Public Health, Patty Nece from the Obesity Action Coalition, and also joining them is Dietram Scheufele, the Taylor Boscom Chair in Science Communication and VILA's Distinguished Achievement Professor at the University of Wisconsin-Madison and in the Morgridge Institute for Research. And then, finally, last but not least, Kevin Ronneberg, Vice President and Associate Medical Director of Health Partners. Please join me in welcoming them. Great. So, Kevin, would you like to start?
Sure.
Okay.
Is this on? Okay. So, wow, what a day, huh? And where to start. So a couple of things that I want to share that stood out to me. And I think Gary's framed them nicely in the prior panel. But I think there's a lot to be said about language as we think about how is it that we move forward and solve obesity and overweight for our nation. One thing that stuck out to me and really created some deep thought for me is earlier in the day, there was an exchange around normalizing versus not normalizing healthy weight. And at least I felt like there was a little bit of healthy tension in the room and an important place for us to spend time on understanding where it is that we need to a certain extent, thread the needle on these solutions, on what's the right outcome that we want and how do we avoid that untoward consequence that could occur if we go too far. And it's really important with all of the emotion around a topic like this, the balance between individual responsibility and social determinants or social drivers. Mm-hmm. So it really struck me that we need to spend time understanding where that perfect spot is where we can thread the needle and establish solutions and communications that can be heard and acted upon in the community by the stakeholders. And I'll layer onto that, I think Brian Dunn talked, I think the term was debiasing in imaging and in some of the communication. And that's something I hadn't been exposed to before, and I thought that's another lever or another way of approaching some of that work once we figure out the right way or where the right place is for this conversation. I think we need to pay attention to another one of the themes that I kept hearing is sometimes we don't want to use the word obesity or overweight, and we don't want to go head on into this. And in doing so, sometimes we can create solutions that might improve physical activity, might improve nutrition, might improve other chronic illnesses, but not truly impact obesity or overweight. And so making sure that we don't lose sight of the solutions that we're trying to drive. And the final thing that I'll say, and I'm still hung up on this, I've been part of the roundtable for 3 years, and I've used this example today. A coworker of mine brought up City Slickers, the movie, and Curly says it's one thing, right? And I don't know what that one thing is, and I don't know how it is that we measure success when we talk about obesity and overweight. What's the one thing? And in lieu of that, what are the process measures or the milestones along the way that we can get really clear at outlining, so that as we're developing solutions and communication campaigns, we don't lose sight of what we're trying to accomplish.
That's great. Thank you. Vish?
Sure. So yeah, I'm reminded of that Gary Trudeau's cartoon. My brain is full. Can I be excused? So it has been an amazing day, and I learned a lot hearing the comments and remarks of other people. So a few bullet point versions of what my reflections, and I'll be happy to amplify it in any way. I think one thing we should learn is that communication cannot solve all the problems. So I think that some of these issues that have been raised today have nothing to do with communications. And I think we should try to really draw that boundary. What is it that communication can do as opposed to what is it other things can do to address issues of obesity or weight, around any of those terms we want to choose. So having said that, I think it shouldn't surprise some of you, at least who heard me. Issues of equity are central to anything we have to do, I think. If you look at the data are very clear, right? So we have been successful. No one can say that our efforts to highlight the attention to the issue of obesity over the last 20, 25 years, or at least 20 years, in a varieties of ways, have been successful. No one can say that they have not been successful. But the question remains, who benefited from the success? So how do those these interventions and policy changes that we have been trying to implement have been taken advantage of by certain sections as opposed to certain other sections of the people. And you look at the data, whether it's high blood pressure, hypertension, whether it's diabetes, whether anything, it's very clear that these inequalities exist and pervasive, and we need to really make it central and continue to highlight that issue, I think, because some people suffer disproportionately from this burden, and we have to continue to remember that. And as a part of that is the issue of communication inequalities, which you talked about. Obviously, it's something we have made it central to our program of research because it is a fact. It is well documented that these interventions around communications, whether it's campaigns, whether it is secular trends in communications, are affecting different groups differently, and we need to really keep that up front, I think. Second, I think the question, this has come up quite a few times, the notion of tension. What do we do? Do we focus on individual behavior change, or do we focus on community? I don't think that's the question here. The question is, what are our goals? Our goals are, if our goal is individual behavior change, that's a different type of communication messaging, communication channeling, usage of channels and interventions. If our goal is policy change, as has been talked about in the previous channel, then that's a very different approach. If our goal is cultural change, denormalizing, normalizing, biasing, debiasing, whatever terms we use, that's a very different goal. So how we design, how we talk about it, what interventions we develop, depends upon what our goals are, and these are not mutually exclusive. I think we have to take into account what is our goal we are trying to achieve, and that's very important for the roundtable to really look at what those goals are. And based on that, of course, there are always going to be unintended effects. There's no question about it. In fact, and we have to have this continuous evaluation instead of learning 2 years from now, 3 years from now that we have screwed up and we have increased stigma. Is there a way that you talked about agility? In fact, with the GRATES grant, thanks to Gates Foundation, we are looking at something called responsive feedback mechanism approach, where we are actually trying to encourage people to constantly measure quickly so that you have that agility and make those course corrections. So that's very critical, I think. I would suggest a third point is we take a social problems and a social mobilization approach. What do I mean by social problems approach? What I mean by that is there are a lot of, I think you said it earlier wonderfully in the panel, there are myriad of conditions, right? You go to the legislators, they will say, look, the biggest problem in Massachusetts right now is transportation. So if you go and talk to them about weight control and obesity, they will say, wait a moment, we have the education problem we have to deal with, we have the transportation problem we have to deal with. We need public support. We need the demand side to agitate for it. How do we do that? I think that's where we have to make it a social problem from a social condition. And we have excellent, outstanding literature all the way going back to the freedom movements, to civil rights movement, to women's movement. We can learn from there to say, how do we mobilize? There are great lessons for us for mobilization, and communication can play a very important, crucial role in mobilizing the public, encouraging the demand side, I think. So that's again a bullet point, I think. So I would say if equity, goals, and social mobilization, if we can use those three, and I have another 25, but I won't go through them, I think we should be able to achieve some of these goals.
Yes. Okay. Awesome. All right. Next, Dietram.
Well, first of all, thank you for having me. I'm probably the one person in this room who knows the least about the topic, so I'm really glad to sit on this panel. What I'm literally going to do is read you some of the reactions from what I put in Evernote throughout the day, things that kind of stuck out to me. I chair, or I co-chair a roundtable for the Academies on effective science communication, and have also vice-chaired a report on communicating science effectively. Vish is on the roundtable as well. But for the report in particular, we started that report with a plea to communities of practice and in the social sciences to abandon what's called the knowledge deficit model of thinking. And many of you know what this is. It's the idea that if people only knew the science better and all the things that agencies and so on knew, then they would make decisions that are more in line with what the experts are saying. And as a result, of course, all communication and good campaigns need to be about information. And we all know that that's not true. At best, that doesn't hold, and there's a null effect. At worst, it polarizes. And I just wanted to highlight that as one outcome that we haven't talked about during the day. There's really interesting emerging research, and I think more and more of it in the area of vaccines, that if you talk to vaccine hesitant parents and you give them all the CDC facts for why they're wrong, they may end up doing worse than the control group. So in other words, they're less likely to vaccinate their children after you've told them all the reasons why they're wrong and why they're doing the wrong thing than if you hadn't done anything. So poor communication based on the knowledge deficit can actually be detrimental and can be worse than doing nothing at all. And I just wanted to put that out as one thing that we haven't thought all that much about. Number two is the idea of framing. It's something that I spent a lot of my career on, and I think one of the things that struck me about the previous session, and I'm saying this intentionally with a little bit of controversy attached to it, and you can tell me why I'm wrong, but it is as dangerous to speculate about framing effects as it is to speculate about the effectiveness of diets and nutritional interventions. So in other words, it's a research problem. The most successful frames in communication, the most successful campaigns are extremely well researched. There's a memo called The Language for the 21st Century that the Republicans circulated in the Hill a long time ago that details how they tested language that is most effective with particular audiences. How does framing work? It works by resonating with underlying schemas that the audience has. Meaning, if I think something is effective as a frame is irrelevant because it may not resonate with the audience. Why is Frankenfood, for instance, so an unbelievably successful frame? Because it gives zero information. What it does is it attaches a highly complex issue, genetically modified crops, to a story that we all know, meaning Frankenstein. Dr. Frankenstein puts stuff together in a lab that doesn't belong together. That stuff gets out of the lab. It's really difficult to rein back in. And exactly like GMOs, I just basically gave you an interpretive framework simply by adding one word, Franken, to food or to salmon or whatever other product I don't want you to eat. That was an extremely well-researched campaign by Greenpeace. They didn't make this up. They didn't think this up. They didn't sit in a room like this and thought about what frames could work. They tested it. And I think that's the plea that I'm making here as you're thinking about, because the idea of framing came up again and again and again. It's a researchable problem, and it's one that needs to be researched, especially as we're talking about different audiences, and we heard about this morning. Number three, the idea of competitive message environments. It took me about 4 hours today to realize that the poster for the event is actually a boxing ring. So speaking of competitive environments in communication, but it's actually a non-trivial problem because we're not the first ones to have talked about this. We're not the only ones to have talked about this. And we're certainly not the one, and we've heard this again and again, with the most money that talk about this. Right? So we're going to be outspent again and again and again, and I think this is where really our key problem comes in, and this also came up again and again during the day, message discipline, which we don't have. Right? And which most other well-organized campaigns have, meaning there's a very clear message and everybody repeats exactly the same thing. And I think that's where certainly the idea of working with partners, and I think this came up during the last panel, and I really want to emphasize this again, is really, really important. A lot of the same ideas about coffee and red wine are, of course, true for this field, meaning it's really difficult for an inattentive consumer, and I mean that all of us are inattentive consumers for most issues, to sort through and extract messages that I can consistently take away. And it's partly because of misinformation and disinformation, but it's also partly because our message discipline, and I'm saying this as somebody who is at universities, which are the worst at message discipline, is just horrible. The last thing I'll say is the idea of narrative, because I think that has come up, storytelling and narrative, as a kind of a magic bullet solution to everything. We wrote a piece recently in PLOS Biology where we argued that this may actually be a little bit of a dangerous path to go down. Why? Because narrative, in many ways, is a great tool, right? Storytelling. It gets across the individual story, but it's also a tool that's agnostic to truth. So in other words, a good story doesn't have to be true. And Brian Southwell's last story, the Australian celebrity that made up the story, it's a great story. Most tweets by our current president are good stories. They have good underlying stories. They happen to very often not be true. And I don't mean in a partisan sense, but it's simply sometimes they just don't have necessarily a factual basis. But they're good stories. So if we actually want to compete with who has the better story, we may very often be at the losing end. And it's a really dangerous area to be in, or dangerous is the wrong word, but it's one that we, I think, want to go in with open eyes and understanding really well what we're doing. So I'll leave it at that.
Great. Thanks. Thank you, Dietram. So we'd like to also have, while we adjust the mic, so Patty, if you could please share your reflections on the day as well.
Can I ask Dietram a question first?
Do.
So how do you square narratives that are maybe a little falsified with truth-telling? I mean, we've heard today that truth is important to build, well, trust is important. So how can you square that?
Absolutely, and I think the most important thing is that what we're saying we have, based on a scientific foundation, we have the best way of producing evidence, right? The scientific evidence behind an intervention or whatever else is the best way that society has of knowing. If the narrative becomes a vehicle to convey that, a narrative is unbelievably powerful, right? If it sticks to that. If a narrative becomes a tool for things other than that, then I think we're basically getting into a fight at a playing field where we have an inherent disadvantage. So that's how I would kind of put the two together.
Yeah, that's interesting. Thank you. Well, I don't know that I have that much to add to what has already been said by this really astute panel, but I guess I think you need to pick your audience first. I don't think you can attack all of them at once. I think Bill has pointed out, the roundtable does not have unlimited resources. And I think you're going to have to pick and choose who you want to target. And then what I drew from the rest of the day is that, and once you do that, you need to identify their values and what they're going to connect with. It's going to be very different between someone like me and a policymaker, for instance. And then set your goals. And I actually do like, it's near and dear to my heart, as you might imagine, the idea that both Bill and Gary said might be the soft target, which is stigma and bias. And it's cross-cutting and less controversial than many other things. I also like the idea of using implicit messaging and providing the counter-narrative without saying you're providing the counter-narrative. I never really thought about my appearance here in those terms, but I hope I have dispelled notions about people with obesity not having or having being relatively smart or having commitment and being dedicated to things. I mean, not lazy. And I never really thought about it before, but I hope that you drew that in out of me being here today. And I think that's important, and it ties in with everything else we heard about positive messaging. giving hope. I love that idea. Give hope, and how it benefits everyone, which was another message that we got today. You know, what am I getting out of it? I'm afraid we think too often in those terms, but I also think that's a reality. Meeting people where they are, the message should do that as well. No matter what the audience is, who the audience is you choose, meet them where they are. Don't expect them to come in your direction. And the consistent messaging piece. I also was struck by, and it's got to make sense. It's got to make common sense. I mean, it's like the miracle cures I had the slide of earlier today. Am I going to lose 25 pounds in 2 weeks? I could stop eating. I'm not going to lose 25 pounds in 2 weeks. That message isn't ever going to resonate with me. So making it something that makes sense to people. Just, it sounds so basic, but we don't always do that. So if the audience you choose is people with obesity, the self-compassion message is huge. You know, most of us beat ourselves up endlessly about our weight, given all the messages from the various outlets we get. Dispelling or eliminating some of those messages would be important, but you know, as Gary pointed out, people that accept themselves as they are now, when they enter his program, enter WW, do better. Makes perfect sense to me because that was my experience. Before I could sustain any sort of weight loss, I had to accept me and stop hating, showing myself some self-compassion. That's what it boiled down to. So I guess I have more questions for you, like how do you build trust? Who is your audience? What message do you want to get out there? Than I do any answers. But those are just some of my observations from today.
Great. Thank you, everyone, for sharing your reflections. I think that gives us a lot to think about. Are we starting a social movement, Vish?
Well, that's a question.
Committee will, it's
I
their
wanna,
job.
I want to mention that
their
we have
problem.
two lavalier mics here. So if you have any questions, you can line up, pose any questions for the panel.
Or thoughts.
And thoughts. And I'd also like to invite the panelists to ask questions of each other as well. This is a discussion, so we'd like everyone to be engaged. Thanks. And if you could introduce yourself and your affiliation, please.
Sure. Hi, it's Chris Economos. I'm from Tufts University, and I'm a member of the Roundtable. Thank you all very much. I wondered if you could pick up on the competitiveness and the discipline part. I was thinking about that all day, too, and hundreds of organizations are communicating around this, even credible organizations, and I think it's challenging. Whether they're true or false, the information is overwhelming. If we were to think about distilling, and if we could actually do that, and trying to encourage organizations to communicate a couple of fairly simple messages, what would your suggestions be for doing that? I think you alluded to other successful public health campaigns or movements trying to do that. Was it communicated through a large meeting? Were they disseminated through guidelines? Were there representatives from different organizations that came together? Just some suggestions about how that might actually happen if people thought that was a direction to move in. Yeah,
I'll take a first
okay,
stab.
Thank you. Thank you.
I think there's a couple of really good examples. So one is I really do think one is partnerships. And one of the very first National Academies committees that I ever was on was a committee that issued a report, the National Academy of Engineering Committee, that was called Changing the Conversation. And the problem that they ran into is that they had a really hard time recruiting female students and minority students into engineering careers. They still do. But part of the reason, or what they wanted to know is what is wrong with our messaging, right? What is our communication problem? And so what we ended up doing is we ended up partnering, and the committee had advertising people on it, had deans of engineering schools on it, social scientists like myself on, and basically tried to, or ended up doing focus groups with students, surveys with students at different class ranks, and figured out, A, what the problem was, and the problem was, just punchline really quickly, that basically we had told students forever that you have to be really good at math in order to get into engineering, and that was true, but if they figured that if they're really good at math and science, they might as well do medicine, which they considered to be much more working with people and rewarding, and engineering just didn't have that perception. And then we ended up testing messages. This goes to my point about framing being an empirical problem, a data-driven problem, right? What messages resonate and work, especially with different audiences, is really important. But then the second step was, how do we get this message out? And this is where partnering with engineering firms, Boeing and others, was really important. They did everything from renting out the Jumbotron in New York City to place these ads, to doing magazine ads, to doing whatever. Although this was a little while ago when buying Facebook ads or whatever else was that just tells you how old I am. That was before that time. But that was the general idea, was actually on the dissemination and kind of what April would call making it happen, or maybe not making it happen, but at least making sure whatever the middle one was, that you're getting there. I think that's a really good example. I think other good examples are what the National Academies is doing with the Science and Entertainment Exchange, trying to change entertainment vehicles in order to get certain science-based messages across. We know that, for example, for smoking, and with all the problems that comparison has to the problem that we're discussing here today, but that the idea of what we perceive to be normal behavior, meaning not smoking, which now seems to be the consensus, that was not the consensus, and it was not the reality on television in the 70s and in the 60s. And that was a concerted effort to change whatever behavior we model. So that's another really good example, also with very unusual channels to get there, and partnerships with the Science and Entertainment Exchange.
Thank you.
Thanks for the question.
Hi, Jeannie Blankenship. I'm with the Academy of Nutrition and Dietetics, and I was really pleased to hear the conversation about communication as a science. I think for a lot of us in the room, it's always difficult to hear that more facts and figures and the science isn't going to convince somebody. And I work on the policy side of our organization. We have different targets for communication. We have the public, we have our members, and then we have policymakers. And I guess when I'm thinking about persuasive communication and that idea that throwing more facts and figures doesn't work, and then what April brought up about the immunizations, it was you that brought that up, that giving more information about that, it actually can lead to less people being immunized. So thinking about the value proposition of this, how do we, my understanding is in persuasive communication that you listen. That when you don't just throw more facts and figures, you try to listen to the other side, you try to gather more information. So what's the level of evidence that having that opportunity to listen is really going to engage policymakers? What can we say, or how do we frame that specifically with policymakers when facts and figures aren't the solution?
Well,
I'd be happy to respond. I just don't want to.
and also I wonder if anyone from session 3 might be able to address that as well. Because it is about how sort of policymakers, how can we talk to them and
we
give
talk
them...
with them all the time. So I mean, it's not, this isn't an uncharted territory, but I think what it comes at, what you bring is the communication science piece versus us going and doing that work and having those conversations.
I actually think Patty's point about values and being able to connect with people's values is not dissimilar for what you end up with policymakers, right? Because they're ultimately the ones who end up selling having to sell a potentially very unpopular to their constituencies policy to them, or have to get reelected on it. Climate is, I think, a really good example. Mitt Romney, for example, when he ran for president, never talked about climate change because he knew it wouldn't necessarily resonate particularly well with his constituency. What he did talk about was energy independence, meaning not fighting wars in countries that we don't want to fight wars in. Said, look, if you want that, you need a clean energy portfolio. You need to invest in this. And also global competitiveness, meaning can I basically play in a world market with Germany, South Korea, China, and all these places that are investing in green energy? If I'm the US, and if you want to, you have to invest in renewable energy. So he basically repackaged, in a very positive way, a policy that was a climate change policy in a way that appealed to the values, not just of his constituency, but I think across the US. I think that's one, it sounds very communication 101, but I think it's not any different. am I able to make a connection between the issue and the value system, the interpretive value system that my audience will use? And that requires listening first, as you say, and then basically says, I'm going to answer the question that you asked, not the ones that I think you should have asked. And I think that's a large part of it.
And sometimes that's hard and painful because, as Patty mentioned, what you hear coming back from the bias and the weight stigma standpoint, I think, is sometimes difficult. And that we want to come back and give more facts and figures. But thank you.
Great. Thank you for the question. Okay. Side.
Hi, Leah Wiggum. I have two affiliations I'll report. I'm here on behalf of the Obesity Society, and my day job is with University of Texas Health Sciences Center. So this morning there were several comments about connectedness and the importance of connectedness. Connectedness is a counter-bias narrative. We need that social connection. We need hope for the future. We share information and misinformation because of the desire to connect. So this theme came through, and it got me started thinking with some of Patty's comments and some of my own work, one-on-one with individuals who deal with obesity in their own lives day to day. How do we establish that connectedness? And is this issue of that internalization of the bias part of the problem in establishing that connectedness?
And I can talk a little bit about that maybe. I think it is. I think the whole stigmatization of people at higher weights is an issue with connectedness. What I can talk about is the Obesity Action Coalition has a yearly convention that's patient-oriented. We bring in great science, we bring in great experts, but what keeps people coming back is the connection. They have found people that understand what they are dealing with on a daily, almost minute-by-minute basis. And that is so overwhelmingly powerful and helpful to people to feel that support. So when I heard, I'd never really thought about misinformation in this way, but when I heard that it is this morning that people communicated to be part of a whole, basically for connectedness purposes, it sort of made sense to me because we all want to belong. But I do think part of the difficulty in energizing people with obesity is the stigma, because so much self-blame is going on that it's hard for them to get by that. The statistics, science, show that, I think they show, I might be speaking out of turn, but I know a lot of people who lose weight using medical help refuse to go, if they regain, they don't go back to their providers and seek more help because they're embarrassed. So it all plays in to that, I think. That maybe that partially helps answer your question.
I just find it interesting as a disease. It's a disease that affects the majority of people.
Right.
And so if you only take it one degree further, that you yourself are affected or someone you know is affected, that's everybody. Much higher number. So why do we have such a hard time with the stigma and the bias when I would like to think that everybody knows someone who's struggling with this disease? I know why to some extent.
Right.
And maybe Rebecca has
Rebecca probably has the answer to that.
But that's what I find such a challenge, and I wonder if this self-internalization of the bias is a big part of that problem and maybe needs to be a bigger target of our efforts. But thanks.
Rebecca, did you want to add to that? Or? Okay. All right.
Can I just respond
please.
just one point on this? I keep harping back to this issue of social movements. Mm-hmm. And because especially when you said internalization, it struck a nerve in me. One part of really mobilizing people is to make them understand that this is unacceptable. This is an unjust condition. This is an unjust assertion, right? Right. Once they realize this is not acceptable, people do mobilize. People do try to connect with other people to agitate for it. I won't be invited back to National Academy of Sciences to keep saying agitation, but protesting is important, right? Protest movements. So I think it's like acceptance. Somehow we have to define the problem as a condition as unjust. I think once we define it, at least from the social movements literature, it's very clear that part of it is internalization, but how do we undo that? I think that's one lesson we have learned from social movements.
Right. Does anyone else have comments to add to that? I mean, yeah, because I think the social movement piece is really something I would like to sit in this spot a little bit longer, because a lot of the changes that we talk about that have to take place to make, say, the healthy choice the easy choice, to enable these actions once we get the message, that's going to require a cultural shift. So, Bill, maybe you have a solution here.
Bill Dietz, consultant to the Roundtable. So we thought a lot about social movements at CDC when I was the division director. And one of the perplexing things about obesity is that there isn't a common perception of a threat. And that's a key to every social movement. And part of that is because there's such a diversity of opinions about what causes obesity. And you come back to the personal responsibility versus environment. I mean, even if it's the environment, how do we make that environment a threat? I mean, it's easier when we focus on something like sugary drinks, which have a defined outcome and a good focus, and it's achievable. But I think that this whole issue of a social movement around obesity is quite challenging. Same thing is true, I think, for climate change. There's a lot of activity about climate change, and people perceive that as a threat, but they haven't gone to the next level, which is developing a cohesive network in which innovation can be rapidly shared and there are clear policies. I mean, it's interesting on the climate change side that there's a lot of discussion about climate change, but very little discussion about how we reverse it and what individuals can do.
Yeah, just a quick comment. I guess just to make a plug for
and if you don't mind introducing yourself
and Luis,
for those online. Yes.
Oh, sorry, Luis Garcia with Market Vision. I come at this from a cultural perspective, and I think, as Patty talked about selecting an audience to focus on, we kind of glossed over it in my presentation when we looked at the prevalence maps. If we're going to start with an audience, understanding this issue crosses cultures, but the African American community and the Hispanic community are, I would propose, the two places to start. That those insights that we learn, the behavior that we can understand, the cultural factors there will teach us fundamentally what applies to the rest of the population. These are lead indicators of where the problem is and how to solve it and where to focus. So I just think culturally, those really honing in on those two audiences, I think, is really I think to your point, this problem of being unjust, it's an urgent matter. This is not it's a long-term problem, but it has an urgent need in those two communities in particular.
Excellent. Anyone else? Social movements? Any other thoughts while we're in this space, and we can come back to it? All right. If not, we'll go back over here for a question.
Hi, good afternoon. My name is Lori Stradley, and I serve as the Chief Program Officer at Alliance for a Healthier Generation, and I'm a member here of the Roundtable. This is my second meeting, so I'm soaking up all kinds of things. I'd like to go back to something you said, Vish, earlier about getting really clear on the result we're trying to achieve. I love that framework, and I live in sort of the RBA, results-based accountability, start with the end in mind and then work backwards. So I'd like to sort of turn that back to you all, and really anyone in the room. If you could sum it up in a measurable way, what is the one result you think that we can achieve with respect to obesity? From the communication perspective. I'm sorry, I didn't mean to get that wide. But if you were to set an intention for communication around obesity, what would that result look like?
I can go for that. Since I can barely spell obesity, I can just say, one of the things, I think Patty actually articulated very eloquently in her presentation. Every time I have these conversations in the communities I work with, right, it is always about individual responsibility. It's about your behavior, your lifestyle, that is leading to this, and that you are responsible for changing these conditions. And if we are all picking one issue, I think that's where I would focus on. I mean, personally, I'm speaking as one person. This notion of individualization, focusing entirely around lifestyle, behavior, leading to the internalization of the problem, etc. I think we really need to address that. It is an issue that has been created not naturally, so people are trying, people are constantly working on it. There is a tremendous stress. We talk about, those of us who work in health inequalities talk about chronic stress, and affecting people. I think we really need to address that issue. And it's just not an individual problem. Even though people are nervous about it, here some have expressed some nervousness in terms of that individual versus community. It is about this obesogenic environment we have created, and take that blame away. We are blaming the victims here in some ways, and we acknowledge agency, personal agency, absolutely, but at the same time really bring it back a little bit.
I'd like to add to Vish's comments. I agree with everything he said, and I'd like to just add too that with any intervention, we build it and we assume people will come. But that's not the case all the time. And so I think that what we need to do with every intervention, I'd like to challenge our interventionists to think about also a communication campaign or a dissemination and implementation plan that goes along with that intervention. Because otherwise you build the park, you build the sidewalks, you put in a new grocery store. If people don't know about it, they're not going to use it. If they don't understand how, well, I don't want to come from a deficit model, but if we need to share information on how to use that food or incorporate it within a family's culture, then we can do that. The other piece to it is that I like Luis's comments about thinking about disparities and certain communities affected by obesity. So some communities have extra information targeted to them of unhealthy foods, but then also live in environments where it's highly obesogenic. So you're almost getting a double inequality, right? That's a slam dunk in inequalities. Poor information about what may be perceived as healthy food or acceptable food, plus you're not getting the healthy food. You're not able to purchase that in your neighborhood. So in those areas, I think that would be a prime target to start with some of our messages. I'd like other folks to think.
The one thing that I go back to, and I can't remember, Patty, if you mentioned it, stigma, language, how we talk about the subject in general. Mm-hmm. There's not a lot of money available. It doesn't take a whole lot of money to have conversations. And we've done that in our organization around race, which is a really important subject. And if you don't talk about it, you can't listen. You can't understand how it's impacting coworkers, how the things you do and you say and how you show up have unintended consequences that you might not appreciate, and you certainly don't want associated with yourself once you're aware of that. We've done that for mental health as an organization. We've seen positive results in the community through that work on increased levels of diagnosis of depression, anxiety, other mental health conditions, and more willingness and interest to have conversations around a difficult subject where there's more challenges in how do we solve for this that are being raised up now. So getting back to how do you create a social movement or develop a sense of this being unjust, I think a lot of this begins with having the conversation and giving people the tools and the resources and the space to have a healthy conversation around what is obesity, what is overweight, how does this occur, what can I do about it? I may not have overweight or obesity, but what is it that I'm doing that's contributing to the problem? What is it that I can do to contribute to the solution? And so I think that's where I would start.
Rebecca?
Hi, Rebecca Poole, University of Connecticut. And thank you to the panel for your insightful comments. I have a lot of thoughts going around in my head from all of the insightful discussions today, but I just thought I would raise one comment and one potential bigger picture question for the roundtable. And the first is actually to underscore something very important that I think Kevin touched on, which is tension, especially with respect to communication. If stigma is going to be a goal, I think that I would encourage the roundtable to embrace that tension. Ted, Kyle, and I were actually at a meeting last spring hosted by the Office of Women's Health, and they brought folks from around the country from very, very different fields and perspectives: obesity, eating disorders, advocacy, public health, medicine, policy, into one room. And the focus of our conversation was, how do we talk about healthy eating and healthy weight, especially when we're targeting girls and women? And I can say that there were very different polarizing perspectives at the table. But I truly believe that the only way that we're going to figure out how to effectively communicate about this is to work through that tension. We need to remember that people with obesity is a very heterogeneous population. And I think the more that we can encourage those uncomfortable conversations, ultimately probably the more effective we'll be. My question is a bigger picture question, which is, I think it's fantastic that it sounds like there is potentially a focus on stigma as part of this communication initiative. And I wonder, though, how effective can we be in addressing this in communication if we live in a country where it's perfectly legal to discriminate on the basis of weight? And this gets to a bigger policy question. If people don't live in Michigan, if they don't live in a handful of cities across the country, then they can be treated unequally because of their weight. So if our message is fundamentally one that people of diverse body sizes deserve to be treated with dignity and respect, but we live in a country where that doesn't happen, then maybe there should be some bigger picture goals for the roundtable in thinking about how do we push policies forward so that people are treated equally. Thanks.
Thank you. Anyone want to react to that?
You can add Washington State to the list for the most part, where you would, I've thought about moving there.
Right, thanks. Next question.
So I actually was hoping to just add a thought to the question you posed around what success could look like. This is Liz Krukova with Novo Nordisk. So I like what you were saying, Kevin, around the stigma and the bias, and I think that's one part of it. We know that we've made some strides when it comes to external bias, but the implicit bias, I think, in terms of really making sure that the conversations we have about weight and health are natural, just like you would have about any other health issue, any other disease. I think that's really important, and I'd like to see that external and implicit bias go down. But I think really seeing obesity become a healthcare priority. So when it comes to care, really seeing, today, if we look at adult Americans, less than 4% have any access to any kind of treatment, medical treatment for obesity. And I think that seeing greater numbers of people seeking and having access, receiving complete and respectful care would be a big win. And that really could encompass anything from nutritional counseling or guidance, coaching, through to intensive behavioral therapy or medicines or surgery, really any kind of wraparound care like you would expect with any kind of other disease. And I think that's really important too, so people can seek and receive that care. Thank you.
I think it's an interesting piece. You start talking about the access to care. I'm a physician. I haven't practiced in a few years now, but I know that weight as a subject in the exam room conjures up all of these things that we've talked about today, that every individual brings a different story and different emotion and different meaning to the table with their weight. And it's a real challenge. I'm sure that I did it really poorly many times, and there's some times I did it well because I got the feedback that I did it well. But there's a huge opportunity in training programs, what it is that organizations that provide care do to support their clinicians, their staff, their schedulers, their nursing staff, on how it is that you engage in these conversations and how it is you support individuals, wherever it is they might be, in their willingness or ability to engage.
Susie Gates from CDC. I wanted to bring it back to communication for a moment and get the panel's insight, because before we can do communication, we have to be very clear on where we're going and what we're trying to achieve. And I've written down like 3 things from today about, are we trying to prevent obesity? Are we trying to reduce obesity among children? Are we trying to reduce obesity among adults with obesity? Are we trying to do environmental change? And I think across this room we'd say, well, we're trying to do all those things. But what I'd like to ask the panel is, where do we start? I mean, Vish said, let's, the social movement, the environmental change piece, and build the movement. But I want to ask you as a panel, like, where do we start? Because communicators, we can't do anything until we know our course and where we're going in the long term. But we got to know where we start.
And maybe what I'll do is I'll ask everyone on the panel just to give a response to that in terms of what might be that first objective. Where do we start?
So you've asked a great question, and one that goes through my head quite a bit. Not being a researcher, I'll share what it is that I understand to be true, and I'll look to others in the room to wave me off if I'm off base. But I think that it's really important for us to declare what that objective is and where is it that we're trying to focus. Not that you can't do other things, but where you start. It seems to me that focusing on children, at the statistic around 80% of children with obesity become adults with obesity, is pretty telling. And oftentimes we can coalesce around caring about our children and our kids. It distances that topic just enough from people to say, I'm willing to invest in our future and our children and trying to help them lead a healthier life. I think there's merit to understanding like where it is we can be the most effective and where it is you can align people the quickest. It's almost like, what's the ROI of your investment on this? And to me, it feels like that might be a space to focus on.
I don't know. I'm not presumptuous enough to say that you have to start at one place, because it's a multifaceted problem depending upon who is actually doing it, whether it is at a clinical level as opposed to a policy level. It varies quite a bit, but that shouldn't stop me from spouting off. But so I think from a communication-centric perspective, there are a number of issues. I think Dietram talked about entertainment and partnership. Let me suggest one place which is not a low-hanging fruit, but it's a hanging fruit. So you can still get it. Advertising, right? If you look at the competitive environment we talked about, one of the competitive environment is a tremendous amount of advertising and marketing that is geared towards people, especially children, but also everyone else. Right? I just mentioned about one brand spending about $4 billion. But if we actually look at the data on the marketing communications, some of these products between fast foods and sugar-sweetened beverages, I think it is an immense amount of money, right? And I don't think we can take it up that easily individually, working together as one coalition at a time, one partner at a time, one institution at a time. I think that's one place. I think, if we have learned from other successful campaigns, I think taking on marketing and advertising, even simple things like my colleague Steve Gottmaker has been doing an interesting project called Choices, right? So he starts modeling. In his models, actually, he shows that if you take taxation subsidy from advertising, right? So if Coke or Pepsi, they write off their advertising expenses as business expenses, and they get the tax breaks for that, right? So if you take that away, that can actually have a profound impact ultimately on obesity related, the risk factors contributing to obesity, right? So that's one example. It's modeling. And Steve is now working around with different states to implement or execute some of those things. So that's one place I would focus on. I'm sure there will be, every person will have their own pet proposals, but that's one place I would focus on.
My answer would probably play to the tension that we've now mentioned a couple times without ever actually calling it out. And that's especially as more and more people are pushing toward an initiative to address the public perception or public image of obesity or of people with obesity. under stigma or whatever else. I think that's where that tension, I saw that coming out today, and I think that's one that A, the committee, and B, this room needs to resolve at some point. And that is a tension, on the one hand, about not stigmatizing, and I think Patty spoke to this morning quite powerfully in ways that I hadn't necessarily thought about a Nike mannequin that if that had been around earlier, maybe people would have thought about, well, I could be that person purchasing that exercise gear and exercising, it would have had positive health outcomes, right? So one hand. On the other hand, we know from literally 40, 50 years of research that modeling certain kinds of behavior or types of ways people look may lead to unhealthy outcomes. And Susie mentioned this this morning, right? We know that people overestimate the likelihood of becoming a victim of a violent crime. They think about scientists as a crazy dude with white hair and a male person that most females don't see as a role model, and so on. So, in other words, how the ways we cultivate images of what a healthy body looks like will have influences on behavior. So it cuts both ways, unfortunately, and that's not an evaluate if I'm not endorsing one or the other. It means that that's a tension that's just in human nature, and we need to resolve that somehow. If you want to say, well, we want to use this for one outcome, then it's a very different strategy than if you want to say we want to fight bias and stigma, which is a different outcome. And I think it's all lumped together right now, and I think sorting that out, I mean, we're talking about the tensions, but we're not really talking about the tensions. So I guess I'm urging us to do that.
Patty, do you have anything to add?
I like talking about the tensions. I think that's a good thing. I think that would be a good thing. I think I'd probably evaluate, the roundtable is very diverse. It's not a patient group, it's not a medical group, it brings all different areas together, right? What can the roundtable accomplish? I mean, I like the idea, for instance, of going after marketing. That's gaining some traction in some other countries, marketing to children. But is that something the roundtable has the ability to influence? And I think maybe I'm stepping back even further into what can the roundtable and its members actually influence? And maybe that determination needs to be made first. It's just the only thought I have to contribute to this.
Well, that's a big one. That's a big one, knowing what power the roundtable has and how we can align our messages with the power of those assets.
Because you can come up with a message, and if you can't do anything with it, you're...
Right, absolutely. So we're almost out of time. This will be our last question. So if you don't mind introducing yourself.
Ted Kyle, I'm a roundtable member. And I just wanted to come back to this question that Kevin raised and something that Rebecca mentioned, which is the diverse audiences when we're trying to address stigma. Patty, you referenced it. And I think an important thing to think about when we're thinking about what we want to normalize is to think about whether we're concerned about normalizing unhealthy weights or normalizing unhealthy behaviors, or put it in the positive, normalizing healthy weights versus normalizing healthy behaviors. Because obesity, truly, given the diversity of audiences that we're dealing with, is the prime case where one size does not fit all. And so a person might be living at a BMI of 35 who has sought treatment for obesity and has a history of a BMI of 50, and another person might be living at a BMI of 35 and have a history of a BMI of 20, and those people are in two very different places in terms of their individual health. So we get into trouble when we try and talk about what is normal, acceptable, good for someone's health and appearance. People are diverse. But behaviors, we certainly can promote healthy behaviors, and a lot of folks in this room have figured that out. The chart that was presented from the American Heart Association on promoting behaviors talked about the language around stuff that people can change versus stuff that they can't. And I would encourage everybody in the room to, have their antenna out when they run across. It's very easy to assume that weight or BMI is a mutable behavior. It is no more a mutable behavior than blood pressure or cholesterol or any other things, but it often gets lumped into something that people have absolute control over, and that's false.
It sounds like there's more work to do in terms of thinking about what those messages are and also underscoring some of the false assumptions we might have about obesity. So I'd like to thank the panel for joining us today to think about reflections from the day.